Have you ever wondered how the medical practices we know and rely on today came to be? The dawn of medicine is shrouded in the mists of time, a fascinating journey that takes us back to the very cradle of civilization. In the earliest days, our ancestors turned to the world around them to seek remedies for their ailments. They used herbs and animal parts, believing in their healing powers. These practices, grounded in observation and experimentation, marked the first steps towards understanding the human body and its maladies. In ancient societies, medicine and spirituality were often intertwined. Healing rituals were performed by shamans and priests who were thought to have a divine connection. They would invoke the spirits, seeking their intervention to cure the sick. Despite the mysticism and superstition, these rituals often involved practical treatments such as the use of medicinal plants, setting the stage for pharmacology. Among the earliest known medical texts is the Edwin Smith Papyrus from ancient Egypt, dating back to the 16th century BCE. This remarkable document details surgical procedures and medical knowledge of the time, providing a glimpse into the advanced understanding of the human body that the Egyptians possessed. Then there were the healing temples of ancient Greece, where the sick would come in search of a cure. These temples were dedicated to Asclepius, the Greek god of medicine, and were the earliest known institutions that could be likened to hospitals. The Greeks also gave us the Hippocratic Oath, a code of ethics for physicians that is still in use today. The dawn of medicine was a time of exploration and discovery, where the boundaries of knowledge were constantly being pushed. The practices may seem primitive by our modern standards, but they were the building blocks of what we now know as medicine. They represent the courage and curiosity of our ancestors who dared to delve into the unknown, seeking ways to heal and to understand the mysteries of the human body. These early steps, as primitive as they may seem to us now, laid the foundation for the field of medicine. As civilizations evolved, so did their understanding of medicine. The cradle of this evolution was ancient Greece, where medical theory took its first significant leap forward. In the 5th century BC, a man named Hippocrates began to challenge the prevailing notion that disease was a divine punishment. Instead, he proposed a new theory, one that would shape the course of medicine for centuries to come. This was the humoral theory. According to Hippocrates, the human body was composed of 4 basic substances, or humors: blood, phlegm, yellow bile, and black bile. Good health, he argued, was a result of these humors being in balance. This concept was revolutionary. It shifted the focus of medicine from the divine to the physical, from the spiritual realm to the observable world. It was no longer about appeasing the gods, but understanding the human body. Healing became a matter of restoring balance, and the role of the physician was to help guide the body back to its natural equilibrium. But the Greeks weren't the only ancient civilization contributing to the rise of medical theory. The Romans too played a significant role. They may not have been as philosophically inclined as their Greek counterparts, but they excelled in one particular area: public health. The Romans understood that health was a community concern. They built aqueducts and sewers, established hospitals, and even implemented measures for waste disposal. They recognized that maintaining a clean and healthy environment was crucial to the well-being of their citizens. This emphasis on public health laid the groundwork for modern epidemiology and sanitation practices. These ancient theories and practices, as rudimentary as they may seem to us today, were pioneering. They transformed medicine from a mystical art to a discipline grounded in observation, analysis, and intervention. Their influence stretched across centuries, shaping medical practices and philosophies in the Middle Ages, the Renaissance, and even into the modern era. The theories and practices from this era had a profound impact on the future of medicine. They remind us that our current understanding of health and disease is built upon the insights and innovations of those who came before us. The Middle Ages and the Renaissance brought their own unique contributions to the field of medicine. As the Roman Empire crumbled, much of its medical knowledge would have been lost were it not for the monasteries of the Middle Ages. These bastions of knowledge and learning preserved countless texts, including those of medical importance. Monks not only copied and translated these precious documents, but also provided care for the sick. Monastic infirmaries were the closest thing to hospitals in these times, offering refuge and treatment to those in need. In addition to preserving knowledge, the Middle Ages also saw the development of new medical theories. The concept of the 4 humors, blood, phlegm, black bile, and yellow bile, became a dominant explanation for illness. This theory, though flawed, marked an attempt to understand disease in systematic terms, a significant step forward in medical thinking. Then came the Renaissance, a period of revitalization and discovery. This era was characterized by an intense focus on humanism, which extended into the field of medicine. The study of human anatomy became a central pursuit, driven by a newfound respect for the human body and a desire to understand it in all its complexities. Two figures stand out from this period: Andreas Vesalius and Leonardo da Vinci. Vesalius, a physician and anatomist, challenged the medical orthodoxy of his time with his groundbreaking work, De Humani Corporis Fabrica, or On the Fabric of the Human Body. Meanwhile, da Vinci, more famously known as an artist, created detailed anatomical drawings that are still admired for their accuracy and artistry. These advancements during the Renaissance laid the groundwork for modern medicine. They encouraged a move away from mystical explanations and towards empirical observation and study. The Renaissance, much like the Middle Ages, was a time of change and growth in the medical field. These periods were pivotal in shaping the future of medical science. The last few centuries have seen an explosion of advancements in medicine. This era, often referred to as the Age of Modern Medicine, brought about discoveries and innovations that have fundamentally reshaped our understanding of health and disease. One of the most transformative discoveries in this period was the identification of germs as the cause of many diseases. In the late 19th century, scientists like Louis Pasteur and Robert Koch helped establish the germ theory of disease, which led to a revolution in how we approach illness. It shifted the focus from treating symptoms to preventing the cause, fundamentally changing our fight against disease. Another monumental development was the advent of vaccines. Edward Jenner's smallpox vaccine in the late 18th century was a game-changer, but it wasn't until the 20th century that vaccines truly came into their own. Polio, measles, mumps, rubella. These were once commonplace and often deadly diseases that have now been largely eradicated thanks to vaccines. The invention and improvement of medical instruments have also played a significant role in advancing modern medicine. The stethoscope, the thermometer, the X-ray machine, these tools have not only made diagnoses more accurate, but they've also made treatment more effective. But the story of modern medicine doesn't end there. The impact of technology on medicine has been profound. Medical imaging, for instance, has transformed the way we diagnose and treat diseases. From X-rays to MRIs and CT scans, we're now able to see inside the human body in ways that were once unimaginable. Similarly, the advent of advanced surgical techniques enabled by technology and an understanding of aseptic principles has dramatically improved patient outcomes. Laparoscopic surgery, robotic surgery, laser surgery, these are all examples of how technology has made surgeries less invasive and more precise. The advancements in modern medicine have drastically improved our ability to diagnose and treat diseases. From the discovery of germs to the development of vaccines and medical imaging, modern medicine has not only extended our lifespans, but it has also improved the quality of our lives. As we look to the future, the possibilities for medicine are endless. Even now, we're on the cusp of a new era where technology and biology intertwine to create unprecedented advancements in healthcare. Imagine a world where treatment is personalized down to the individual's genetic makeup. This is not science fiction, but the promising reality of personalized medicine. By analyzing a person's DNA, doctors could potentially predict diseases before they occur and prescribe treatments tailored to the individual's genetic profile. This could lead to more effective treatments with fewer side effects, transforming healthcare as we know it. In parallel, the field of gene editing is heralding a new age of possibility. Techniques such as CRISPR-Cas9 have made it possible to precisely edit genes, potentially curing genetic diseases, improving crop yields, and even extending human lifespan. The ethical considerations are complex, but the potential to eradicate diseases like cystic fibrosis or Huntington's disease is a tantalizing prospect. And let's not forget the impact of artificial intelligence on medicine. AI has the potential to revolutionize diagnostic procedures, drug discovery, patient monitoring, and more. Intelligent algorithms could analyze vast amounts of data in seconds, spotting patterns and correlations that would take a human mind years to decipher. This could lead to faster, more accurate diagnoses and ultimately, better patient outcomes. But all these advancements hinge on one thing: continued research and innovation. The medical field is a constant race against time as new diseases emerge and old ones evolve. The tools we have today are the result of centuries of scientific endeavor, and the tools of tomorrow will be the fruit of today's research. The future of medicine is a nexus of biology, technology, ethics, and imagination. It's a world where the impossible becomes possible, where we cure the incurable and defy the limitations of the human body. The history of medicine is a testament to human ingenuity and our relentless pursuit for better health. Let's take a moment to reflect on what we've learned. We've journeyed from the dawn of medicine, discovering the roots of medical theory, and traversing through the Middle Ages and the Renaissance. We've seen how medicine evolved into its modern form and peeked into the exciting future that awaits this field. From the earliest known medical practices to the cutting-edge techniques of today, the journey of medicine is a fascinating tale of discovery, innovation, and resilience.